Huijun Shen. Please allow me to introduce Professor Huijun Shen briefly. Huijun Shen is a professor and a consultant from China Top University Hospital TCM. Is well qualified and highly experienced in both conventional Western medicine and traditional Chinese medicine. He possesses 2 medical degrees from Beijing and Shanghai University of TCM, with over 25 years of clinical in both China and the UK. Since 2005, Dr. Shen has been teaching acupuncture and traditional Chinese medicine as a senior lecturer and clinical director of acupuncture program in University of Lincoln. He also teaching TCM in other European countries such as Netherlands, Ireland, and Portugal. Please welcome Professor Huijun Shen. And the team is TCM Clinical Research and the International Research Model. Please welcome.
Thank you. I had this presentation last month in China, of course in Chinese, because I think this is important topic for the China's clinical researchers of TCM. I think to promote the internationalization, the international development of Chinese medicine, I think this topic is important. But here I have a quite big presentation with over 80 slides. I will escape many of them because we don't have enough time for today. Outline, basically introduction why this topic I think is important, and the overseas methodology. When I say overseas, it's from the viewpoint of China. Overseas means outside China, not outside UK, and so I didn't change the word. We can say international methodology if you want, yeah. And the basic character of international methodologies in Chinese in clinical trials, and some examples of the common methodologies in clinical studies, and so on quickly. Yeah. Firstly, nowadays we talk about evidence-based. We all know evidence-based medicine is a popular area in medical studies, medical field. And some people also say in TCM, we need evidence-based, which also makes sense, of course. But there are some problems with so-called evidence-based TCM. I'll talk about this a little bit. Yeah. The big issue for me to raise this issue, this topic, is in China. I'm sure most people here knows. In China, there are a lot of clinical studies on Chinese medicine every year. Yeah, big, massive quantity of the reports published in TCM journals and so on. However, such studies, reports in China make very little international impact. Yeah. So outside the world don't know that much about how good TCM is in the clinical treatment and so on. So I think the different methodology used in China is a big reason why the international field, international clinical medical field do not recognize TCM as they should be. Yeah, this is the reason. I just go through very quickly the first thing about so-called evidence-based TCM. Yeah, evidence. What is evidence medicine? It's in here. And the history of evidence-based medicine, you can say, developed firstly in UK, from UK. Yeah. Relatively very young, you can say in 1992, the Cochrane Center opened in Oxford. And in Western medicine, China followed up quite quickly. The first Chinese Cochrane Center was established in 1999. That's Western medicine in China. Yeah. And then early time, we know this is character for so-called evidence-based medicine. Yeah. What matters most in evidence-based medicine is randomized controlled trials, RCT, and what's more, on top of that is systematic review. Yeah. So case studies, less important, less strong with evidence, we all know this. Yeah. And so to do the clinical trials based on evidence-based medicine, they need to give a control group, randomization, placebo consideration, double blind if possible, and so on. Such concepts are already used in Chinese medicine clinical studies, yeah, in certain degree. Yeah. And then we come to evidence-based TCM. Yeah. And it seems like overseas, outside China, such studies are more focused on acupuncture. Yeah. With Chinese herbal medicine, the evidence is still rather weak. There are some RCTs and systematic reviews already published. Yeah. But generally speaking, still, mostly they are not conclusive. They're not conclusive. For example, in the early time, this is more than 10 years ago, acupuncture for knee osteoarthritis, this kind of studies already give the evidence acupuncture can be effective for this kind of conditions. Yeah. And Chinese herbal medicine for IBS and so on. Also clinical trials give some evidence already. Yeah. However, generally speaking, still the systematic review of Chinese herbal medicine still weak and without conclusion and reflecting the quality of the clinical trials. There are some problems with the quality and so on. Yeah. So this is the situation where we're in nowadays. Yeah. And still a long way to go with evidence-based TCM. Yeah, evidence-based TCM. Over 10 years ago, I raised this question. That every year in China, so many big, massive quantity of studies published every year, but internationally, they don't make good sense. Yeah, they don't make good sense. And outside China, people don't recognize how effective TCM or acupuncture is. So I raised this question 10 years ago, or more than 10 years ago. Now the situation is slightly better, especially with the quantity of the papers published internationally from China. You can say I did this study here from Google Scholar. If you search acupuncture in year 2000, yeah, the total result over 15,000. Yeah. If I counted the first 100 papers, only 4 of them from China. 4% is very, very low. After 10 years, 15%. This year, 23%. Yeah. So the Chinese studies Chinese clinical trials surely gave more international impact nowadays. But still, if we look at the quantity, it's getting better. But my topic is not on quantity. I'm looking at the quality more. And we all know this is a very embarrassing topic. The data from China seems like quite often too good to be true. Yeah, always published how high the cure rate, success rate. Yeah, 90%, 95%. Yeah, and people can hardly believe that. Yeah, always. Because I teach acupuncture, Chinese medicine, some students or some practitioners, they did some research and they research questions. Like certain formula, herbal formula, like for example, treat IBS, yeah, can be so effective. So why don't they get Nobel Prize? Yeah, if it's so effective. Yeah. So the standards, the quality of the study, that's why make the result so high, so too good to be true. Yeah. And in recent years, there are some more systematic studies, reviews, done by Chinese scholars, yeah, Chinese researchers, like this one. So this is the situation now. Yeah, in China, so many different clinical trials published. But if you put the whole picture together, for example, this one for IVF, yeah, Chinese herbal medicine improve the outcome of IVF, yeah. The conclusion, you can say, the conclusion, not very positive. Even some studies gave very good result, yeah, very good result, even like too good to be true, because of the quality of their study design of the clinical trials and so on. So the conclusion, not very positive. Yeah. Another one on the miscarriage, recurrent miscarriage treated by Chinese herbal medicine. Yeah. And again, similar conclusion, not very positive, yeah, rather negative basically. So this is the situation. Because one of major reasons to hinder the development of TCM in the world is lack of adoption of internationally recognized research methods. The standards of studies, yeah, still quite low. So therefore, the efficacy of TCM is yet to be generally recognized by the mainstream medical field in the world. Yeah. No matter how we say TCM is good, I think it matters much better, much more for the mainstream field, Western medicine, to accept TCM is good for certain conditions. Yeah. So it's really, no matter how good we say, yeah. So this is the situation why I raise these questions. So why I say overseas methodologies, I think basically I would like to tell the Chinese researchers, yeah, like last month I did, yeah. So why I recommend the overseas methodologies, yeah. This is the reason, yeah, basically. We always say this kind of, what is called dilemma of TCM. We always say practitioners talk about the result of their clinical treatment. Yeah, it works, and we can make patients feel better, but we cannot give evidence. Yeah. Actually, we don't know. Feeling better is already evidence. Yeah. We need to give them good methodology to measure the feeling better, yeah, like it says here, to make something from subjective to objective, from sensory feeling to digital data, yeah, something immeasurable to measurable. Yeah, this is what we need to do in TCM clinical trials. Yeah, in TCM clinical trials. An example is for frozen shoulder here. You can see this is Chinese standards. This is Chinese standards by Chinese authority, state administration of TCM. Okay? So all the Chinese researchers, mostly they follow these Chinese standards. If we compare the international methodology standards, you can see there's such big difference. This one is like a more qualitative study, yeah, and this one, international one, is quantitative studies, yeah. Give you the data, digitals, numbers, yeah, and different levels and so on. So that's why I mentioned this kind of method should be encouraged in the TCM studies in China. Not much like in here. Really, we don't have the environment to do such studies. Yeah, really. So that's why even Chinese colleagues here, we're living in Western countries, but we should give the message to our colleagues in China. Yeah, pay more attention to this issue. Yeah. Like this one, shoulder function assessment scale for frozen shoulder arthritis. This is good method. Yeah, if we use acupuncture or trainer for frozen shoulder, this is something we can use. Yeah. And back pain. This is quite old study, 12 years ago. Back pain. And you can see this study was done by a hospital in New York. But actually the leading researchers are two Chinese doctors. They used the methodology, somewhere I mentioned methodology, is this one. Lowland Chronic Disability, what's the word? Questionnaire. Yeah, questionnaire. Basically, only like 24 questions, all related to back pain. Yeah, all related to back pain. And I may go through this a bit later. Yeah. So I gave some examples here on the methodology for pain relief, pain-related conditions, for genital conditions, for emotional disorders, for skin conditions, for other conditions as well. Only examples, too many to mention here. For example, for pain-related conditions, very basic methodology is VAS, yeah, and Lowland-Morris Disability Questionnaire for back pain, shoulder function assessment scale, I said for frozen shoulder and so on, chronic migraine severity scale for migraine. This kind of method, I think, very good in the use of TCM clinical trials. Now the Chinese clinical doctors, researchers, they start to pay more attention on this kind of things, the international methodologies, yeah. But I think they still need a big push to go further, yeah, Yeah. And I just gave this kind of slides. You can see for back pain, this method, Lowland-Morris questionnaire, basically 24 questions, all related to back pain, and the patient just answers yes or no. Yes is 1 point, no is 0 point, And then after 24 questions, you can give the total points, and you can work out before treatment, after treatment, your acupuncture group, control group, and you can do the analysis. And this is very good, these studies. The reason I mention this study using this method is really because the UK government recommend back pain. They use this study. Yeah, they use this study. Nice. Yeah, nice. They gave this reference. Yeah. What's more? I pressed wrong button. Oh, sorry. Yeah. Yeah, this is very good for migraine. If somebody, or you know somebody in China, is doing clinical trials on migraine, this is very good, very useful. Yeah. And for general conditions, you can see the activities of daily living scale. This is good. Yeah, very useful for general well-being. The patient will feel better or not, and then we can compare the different groups before treatment and after treatment, and also can give very, very good results. Yeah. And SF36 is MOS 36 item short form health survey for general condition as well, general well-being. Already in TCM field, some hospitals in China, they already started to use this method. You can say the Chinese translation is already available now. Yeah, Chinese translation already available. We don't go through this. Yeah. And for depression, we also have very good method for insomnia, sleeping disorders. You can say a lot of things here. Yeah. And I hope this kind of methodology should get more popular and more commonly used in Chinese studies, yeah, from China. Hopefully one day. Yeah. This is also very useful tools. Yeah. Peaceful sleep quality index. Yeah. And skin conditions, a lot of things. And even itchiness, you can see there's no measurement to match the itchiness, severity of the itchiness, but they can still give some questionnaire to score the severity of itchiness, you can see. And this eczema as well. Yeah. This is very good one. Eczema area and severity index score. Yeah, very good. And I did this presentation in China a few times, and they were quite impressed with the skin methodology on skin conditions. Yeah. This one also useful. International prostate symptom scoring, female menopause assessment scale, even stools for diarrhea, constipation, Bristol stool chart. Yeah, something not very nice to talk about, but it's useful. Yeah. Yeah, this one. Yeah. Basically, you can give a score on the stools as well. Yeah. We know in the evidence-based medicine, they set up some standards for clinical trials. From the design to reporting, they have the standards. Consult, stricter, and so on. I don't go through the details here, but Chinese researchers already noticed this, and you can say consult already published in Chinese. Yeah, consult already published in Chinese. Stricter for acupuncture studies, also published in Chinese as well. Yeah. So really this is, I think it's good development. And PRISMA is the standard for the systematic reviews. Yeah, systematic reviews. Yeah, it's a checklist. Yeah, and so on. So basically, that's my topic. Yeah. Any questions?
Thank you very much for the presentation. Introduce the research, clinical research, and international research model. I think it's very important for the TCM to go to the world, to be accepted in the world. So, if anybody have a question?
Thank you very much for Dr. Huijun Shen for your speech. It's fantastic. My question is, as you know, most of our practitioners in the UK, we are just a clinician. We work alone in our just clinic. Most of us treating so many years, hundreds of thousands patients, but we have no evidence. We have no methods. We have no facilities to do this research. Do you have any suggestion as a practitioner? How could we do something similar or according to the method to do some clinical study or clinical trial or something like that? Thank you for your
Basically, I think not possible. Because, in this country, you are not allowed just to do the clinical trials on people without authorization, and basically you need to apply for approval, at least by some like in Lincoln University, at least the Lincoln University, they have the ethical committee, and you can't, and at least you need to get approved by ethical committee, because this is study on human being. Yeah, so that's why my topic, maybe this is not good place talk about this topic. Really, I pushed hard to China, yeah, and I just sell my idea to Chinese researchers in China. And here, what can we do? I don't know. Sorry.
Anyway, thank you for your answer.
Okay.
Okay, because the time tissue, so only one question available, please.
Thank you, Professor Shen. As system reviews rank top at evidence-based medicine research, so what are the instrument strategies would you recommend? Because you mentioned many instruments about clinical trials and not many about the systematic reviews. So what would be your recommendation for the instruments?
My idea actually is to use the same or at least the similar standards and methodology in the clinical trials. For example, for migraine, yeah, and don't use the Chinese method to calculate the cure rate, the effective rate, and so on. Instead, you gave some figures, digital data, and the severity. Yeah, that slice on migraine, like for example, is a good example. How many days in the month you have headache? Yeah, how many days of the month you need to take painkillers? How many days of in the month you feel the migraine affecting your everyday life, such thing, each single item actually can give digital data already, and you work out the treatment, how effective it is. This is very good methodology. And I think it's not, in China, generally speaking, the quality of the clinical trials is still not very good. It's not the fault of Chinese doctors. It's people high up, the state administration of TCM. They know very little about clinical studies. They set up very rubbish standards. Yeah, that's the situation. Yeah.
Okay. Okay. Thank you. Let's begin the next subject. Okay.
Okay. Because the time. Next, after then, every speaker try control about 20 minutes. Okay, because time.